When someone has erectile dysfunctions, they cannot get and keep erections to have sexual intercourse. Erectile dysfunction is usually due to the combinations of the physiological and physical health issues that affect the blood vessels, hormones, muscles, nerve, and brain. Some of the most common causes of the ED are stress, relationship problems, depressions, obesity, high blood pressure, low testosterone levels. Viagra helps men get and keep erections by increasing blood flow to the penis. It works as vasodilator and causes blood vessels to relax. You should check with their doctors before taking it. If you have any of the following medical condition, it is the best to talk with your doctor about whatever Viagra is right for you or not. Low blood pressures, high blood pressures, coronary artery disease, arrhythmia, heart attack, stroke. Viagra should be taken orally 30 minutes to 4 hours before sexual activity, but is most effective if taken 1 hour before it. The standard dose is 50 milligrams. Dosage strength will vary from the person to person, so it's always best to speak with the healthcare professionals about how much Viagra is right for you. Making sure you are sexually aroused will increase the probability of this working for you. Once it does start to work, you can expect your erections to last anywhere from 2 to 3 hours. Just like with any medications, taking Viagra comes with the potential for experiencing side effects. These are the most common side effects of Viagra: nausea, headache, flushing, stuffy nose, running nose, blurred visions, muscle pain, dizziness, and rash. How long does Viagra last? A single dose of Viagra will leave your system within the 8 hours, and almost all of it will be gone after 24 hours. You will see most of the common minor side effects go away by over the periods of the time, but the rarer, more severe side effect can be more permanent. Viagra indications. There are some drug-to-drug interactions with the Viagra. Individual taking a class of the drug called nitrate should not taking with Viagra, as this combination can cause dangerous drops in the blood pressures. You should not take Viagra with the following medications. If you enjoyed this video, please subscribe our channel.